Good day, this is Professor Will, CBMD PhD. Today is Wednesday, March 25th, 2020. It is 12:46 and 52 seconds p.m. Eastern Standard Time. And this is a continuation of my corona research. So let's get started here. COVID-19. The immune system can fight back. Date March 17, 2020. Source University of Melbourne. Summary. Researchers were able to test blood samples at 4 different time points in an otherwise healthy woman in her 40s, who presented with COVID-19 and had mild to moderate symptoms requiring hospital admission. Melbourne researchers have mapped immune responses from one of Australia's first novel coronavirus, COVID-19 patients, showing the body's ability to fight the virus and recover the infection. Researchers say this was the first time that broad immune responses to COVID-19 have been reported. We looked at the whole breadth of the immune response. In this patient, using the knowledge we have built over many years of looking at immune responses in patients hospitalized with influenza. 3 days after the patient was admitted, we saw large populations of several immune cells, which are often a telltale sign of recovery during seasonal influenza infection. So we predicted that the patient would recover in 3 days, which is what happened. When COVID-19 emerged, we already had ethics and protocols in place, so we would rapidly start looking at the virus and immune system in great detail. We showed that even though COVID-19 is caused by a new virus, in an otherwise healthy person, a robust immune response across different cell types was associated with clinical recovery, similar to that we see in influenza. This is an incredible step forward in understanding what drives recovery of COVID-19. People can use our methods to understand the immune response in larger COVID-19 cohorts, and also understand what's lacking in 2 who have fatal outcomes. Researchers say that current estimates show that more than 80% of COVID-19 cases are mild to moderate, and understanding the immune response in these mild cases is very important research. We hope to now expand our work nationally and internationally to understand why some people die from COVID-19, and build further knowledge to assist in the rapid response of COVID-19 and future emerging viruses. New study on COVID-19 estimates 5.1 days for incubation period. Median time for exposure to symptoms affirms earlier estimates and supports CDC's current 14-day quarantine period. Date March 10, 2020. Source Johns Hopkins University Bloomberg School of Public Health. Summary. An analysis of publicly available data on infections from the new coronavirus SARS-CoV-2 that caused the respiratory illness COVID-19 yielded an estimate of 5.1 days for the median disease incubation period according to the new study. The analysis suggests that about 97.5% of people who develop symptoms of SARS-CoV-2 infection will do so within 11.5 days of exposure. The researchers estimated that for every 10,000 individuals quarantined for 14 days, only about 101 would develop symptoms after being released from quarantine. For the study, the researchers analyzed 181 cases from China, and other countries that were detected prior to February 24th were reported in the media and included likely dates of exposure and the symptom onset. Most of the cases involved travel to or from Wuhan, China, the city at the center of epidemic or exposure to individuals who had been to Hubei, the province for which Wuhan is the capital. The CDC and many other public health authorities around the world have been using a 14-day quarantine or active monitoring period for individuals who are known to be at high risk of infection due to contact with known cases or travel to a heavily affected area. Based on our analysis of publicly available data, the current recommendation of 14 days for active monitoring or quarantine is reasonable, although with that period some cases would be missed over the long term. The global outbreak of SARS-CoV-2 infection emerged in December 2019 in Wuhan, a city of 11 million in central China. It has resulted in 95,333 official confirmed cases around the world, and 3,282 deaths from pneumonia caused by the virus. The majority of the cases are from Wuhan, the surrounding Hubei province, although dozens of other countries have been affected, including the US, but chiefly South Korea, Iran, and Italy. An accurate estimate of the disease incubation period for a new virus makes it easier for epidemiologists to gauge the likely dynamics of the outbreak, allows for public health officials to design effective quarantine and other control measures. Quarantine is typically slow and may ultimately stop the spread of infection, even if there are some outlier cases with incubation periods that exceed the quarantine period. Researchers note that sequestering people in a way that prevents them from working has cost, both personal and societal, which is perhaps most obvious when healthcare workers and first responders like firefighters are quarantined. The new estimate of 5.1 days for the median incubation period of SARS-CoV-2 is similar to estimates from the earliest studies of this new virus, which were based on fewer cases. This incubation period for SARS-CoV-2 is in the same range of SARS-CoV, a different human-infecting coronavirus that caused a major outbreak centered in southern China and Hong Kong from 2002 to 2004. For MERS-CoV, a coronavirus that has caused hundreds of cases in the Middle East, with a relatively high fatality rate, the estimated mean incubation period is 5 to 7 days. Human coronaviruses that cause common colds have mean illness incubation periods of about 3 days. Good day, this is Professor Will, CBMD PhD on infectious disease and pathophysiology. Hope you enjoyed listening to my mini lecture on Corona COVID-19. Well, have a great day.